Hey, Dr. Kelly Starrett here, talking about using the Tim Tam with a little bit more technique. And when we put this into people's hands, they intuitively understand what it's for. I put this on areas that are stiff, I put this on areas that are painful, and I just start smashing the crap out of them. Well, it turns out we can be a little bit more sensitive and a little bit more sophisticated in our use of the Tim Tam. Now, this high velocity percussion we know is a miraculous treatment in terms of restoring blood flow, improving range of motion, and desensitizing stiff and painful areas. But one of the things that we can do also with it is create what we call a little tack and floss. So if you ever are familiar with the idea of it, like an active release therapy, is that I basically try to use some kind of device or hand or model or a roller or ball. What ends up happening is I tack the tissue down and then I try to pull the underlying sort of tissues underneath it. So if I push on the skin and then move my hand as an example, one of the things that happens is that the skin and derma and fascia remains connected on top, and then I restore the sliding surfaces underneath. Well, one of the things that people forget about doing is trying to move while simultaneously using the Tim Tam. So for example, instead of just being isolation on a certain area, one of the things I can do is I can actually add a little bit of tissue shear or a sliding stress on this as I simultaneously flex and extend my leg. This sort of, not only do I work on a localized level, but I works on restoring the global sliding surfaces in the area. So as I tack, I'm pushing and flexing and straightening my leg. And what you'll see is if you go from a shortened position to a lengthened position, you're able to free up the sliding surfaces as you kind of simultaneously re-tack them. So what I'm asking you to do is anytime you're using the Tim Tam, a good technique is to try to add as much motion in the joints upstream and downstream of the area that you're working. What you're going to find is that instead of just working on this area, you're able to restore how the tissues slide upstream and downstream of that. So the goal here is that you should be like layers of warm silk sliding over steel springs. Most of us are pretty tacked down like grilled cheese sandwiches with nails running through them. The Tim Tam with a little movement is a recipe for success.